Menopause describes the stage of a woman's life when her menstrual periods stop permanently and she can no longer get pregnant. Menopause is not a disease, it's not a disorder, but it's rather a normal part of aging for women. The period or time leading up to menopause is called the menopausal transition or perimenopause. Some women have no or mild menopausal symptoms and may even feel relieved when they no longer need to worry about periods or getting pregnant. But let's talk a little bit about this, because for other women, the menopausal transition can bring various symptoms, including hot flushes, night sweats, trouble sleeping, joint and muscle discomfort, pain during sex, moodiness and irritability, forgetfulness, difficulty concentrating, or a combination of all of these symptoms that I've just mentioned. Let's speak to the president of the South African Menopause Society, Dr. Malikah van der Schyff. Pleasure to have you, Doctor. Thank you very, very much for joining us here on the program.
Thank you so much for the invitation, and good morning to you and your viewers.
Such an important conversation, and perhaps maybe I'm bold in saying we don't discuss this enough.
Absolutely.
Because a lot of women suffer in silence, whereas what they're going through is very normal. I gave a list of the symptoms that women may experience in the beginning. Do you think that covers it? Are there more? What should we look out for?
So, thank you for that, and you were quite comprehensive, and I think that we underestimate these symptoms, their extent, and how the menopause transition can absolutely invade every pore of your body. So it's usually the predominant thing. I must start ahead of everything and just say that it's usually changes to your menstrual cycle that you need to look out for. And that this is then accompanied with these symptoms, which we call the vasomotor symptoms, the commonest ones being what you had mentioned, hot flushes. And the hot flushes can be quite debilitating. So, for example, if you were in the middle of a show and you suddenly got hit with an extreme hot flush that causes you to be so absolutely hot that you actually feel like shivering afterwards, it would be very debilitating for an interview, the workspace, when you're busy teaching, working, any of these things. And hot flushes and night sweats are usually the ones that patients will complain the most about. And I think that the other things that they complain about as well would be the disruption in sleep. Yeah. And then we always underestimate the effect that it has on everything else as well. Irritability, what the insomnia and loss of sleep would do, mood swings or irregular mood, just feeling a little out of control. So that traffic violation really gets to you more than it would have a few years earlier. So those are the predominant ones. I think the other things that women often would complain about is general body aches, anxiety, mental health issues, aches, pains, all of those things. And of course, let's not forget weight gain as well, which women, no matter how much they try sometimes in and around the menopause, that little menopause belt around the waist just does not want to go away.
Wow, this is exciting. What can I tell you? As a woman,
exactly. And the more exciting thing is it can last anywhere from... Yes, and it can last for 2 to 8 years.
No, you're joking. Oh my gosh, doctor. Okay, so...
Well, that's what the statistics can tell you.
I suppose so. That's the thing. So let me ask you, we were looking at a graphic online there, so just over us, and we were looking at the age groups and when it may start. And obviously this differs in women. Everybody is different. But in general, does it start over 35? Is that when you should start looking? And
No.
Later, 40s?
So ideally, yes.
Okay.
Ideally in, mid-40s onwards. Earlier than that, we would consider being premature to menopause.
Okay.
The real average age is supposed to be 50, 51. That's what the statistics that come out of America tells us. But I think it's also important what happens to your older sisters, what happened to your mom, what's in your family as well. And the important thing here to get across to your viewers is, if you're between 35, 45, or even in your late 40s, do not automatically assume that your period staying away or irregular, weird menstruation is automatically menopause. I do find that a lot of people neglect going to their gynecologist or woman doctors because they just go, oh, it's change of life.
Yeah.
I'm just going to go through this. It'll go away. And this is the important thing to get across today to your viewers, is that go and access healthcare if you think it's happening too early, because there really is too early.
Yeah, indeed. So that's important to know, and that women must get checked up if in fact it's happening too early. Are the first signs, and I mean obviously we go through a lot of emotions as a woman. That's our rite of passage. We know that. But let's talk to our cycle. Is that the first thing, when you start seeing that you are, if you're of that age where it should be happening, you start missing your period, or it gets later, or it starts earlier, or it gets shorter, and then you get to a point where it stops altogether? How long can that process actually last?
So that can actually take a few months to years as well.
Okay.
And as I said, the important thing here is it's often what you mentioned, that cycle lengthens a little bit, that it gets a little longer, and that you actually it is ideally supposed to get lighter. So if you're having continuous heavy periods, this is a problem. If you're having irregular bleeding in between your cycle, if you're having irregular bleeding after sex, if you're having weird irregular bleeding that is continuous, that needs to be checked out and cannot just be labeled as perimenopause. So I think the moral of the story is go check that the pattern that you are undergoing is physiological and so-called normal.
So, I mean, everything we've spoken about, obviously, besides the flow and all of those kind of things that you know we have to deal with, some of these symptoms are debilitating, and there's no two ways about it. I mean, if you're going through depression, anxiety, and mental illness, because this is something, and I know many women say this gets, it affects you mentally, it affects your relationships with everybody. It is a big thing. And there is a big debate whether or not to actually get onto hormone replacements or not. Let's weigh into that conversation. There is help out there, but the pros and cons.
So one of the things I must just say that you highlighted here is mental health, and that, mental health in its very subtle form, whether it is women who are experiencing just palpitations or anxiety worse than before, or those who actually have depression and are much more likely to have a major depressive episode in their perimenopause or in menopause. This is important to go and seek help. And menopausal hormonal therapy has gotten a very bad reputation for very wrong reasons. And it needs, whether or not you go onto treatment, which will improve your quality of life, which will take away some of those, what we call the vasomotor symptoms, which can prevent that fogginess, the brain fog, the anxiety, all of those things. Whether or not you institute treatment for all of this is going to be a relationship between your gynecologist and you. It's going to involve, an assessment of your health status at the time, what your risks are, what we believe the pros and the cons are for you. And, not everybody reacts the same to menopausal hormonal therapy, but we need to try and choose what would be the lowest, most effective dosage in the right mode. Whether it be a pill, whether it be a tablet, whether it be a gel, any of those things, whether any of those things would be the mode of your menopausal hormonal therapy is also relevant, and then going on to them. As for the pros and cons, it would be weighing up what your risk is at the moment. One of the most important things for me to check for one of my patients, for any of my patients who are about to initiate menopausal hormonal therapy, is that you need to be cardiovascularly healthy. What are your comorbid conditions? What is your cholesterol? We find that cholesterol can go up quite significantly in and around midlife and in and around that perimenopause, which is that time before your period stays away completely for 1 year.
And this is something that we need to take into effect, because some of the disadvantages, and I think, as you say, you do get your life back when you are on these hormone replacements. But many people worry about the fact that it does increase your chance of getting cancer, different forms of cancer. Is there truth to this? How does it increase the risk?
So there is, and it's a very complex relationship, the relationship between hormones and breast cancer, and the relationship between menopausal hormonal therapy and breast cancer. And you will find that if before we start any patient on any menopausal hormonal therapy, we will make sure that they have a mammogram as a baseline and as a screen, so that if they do go for their menopausal checks afterwards and their mammos afterwards, we do survey and we do try to pick up on that. But it can actually protect you against other cancers like uterine, ovary, and colon cancer. So there's actually a protective effect there. It can be cardiovascularly protective if you have a healthy heart. It can be protective against the brain, and it can be protective, as in neuroprotective, and it can be protective against osteoporosis. Although our major reason for starting it would be to improve your quality of life with those terrible, debilitating vasomotor symptoms.
Yeah.
And like starting any medication, it's a scary process going down this avenue of knowing I am now on this type of treatment, be it menopausal hormonal therapies, your diabetic therapies, your hypertensive, your cholesterol therapies. All medications do come with their side effects. And the important thing is that we monitor, we check that you are a candidate for it, as in you're not high risk. There are contraindications. You know, we do want certain things under control, cholesterol, hypertension, diabetes, things like that. It can actually, hormonal therapies can actually lower your diabetes by lowering your insulin resistance.
Yeah.
So it can actually help with glucose metabolism. Yet some, you know, we are sometimes scared to start patients on that. And the most important thing about this entire thing is that it needs to be a relationship between you and me, that you understand the risks. I've explained them. I've chosen the lowest possible and the best mode.
Indeed.
And that, you know, we both would trust in that.
Yeah.
And, you know, that I've got my evidence base behind me. And that's why our South African Menopause Society is so adamant in education around menopausal hormonal therapy, because it can be quite lacking.
It must
and
be. So,
also where the public is concerned.
Yeah, I need to let you go because I know that you've got another interview or you've got to be out. But my very quick final question to you is, we've spoken about perimenopause, we've spoken about going through menopause and how to help. What happens when it's all over? I mean, are you out in the clear? Because some women think, okay, well, now I don't have to go for all these regular pap smears and all of these breast sort of scans and all of these things. What happens then? You still do life as usual?
So the important thing that I need to tell you around this question is, because many of our women going through midlife now did not have access or availability, it was not there then, the HPV vaccine that we're now giving to younger girls to try and protect them against cervical cancer, we still need to encourage women to go for their cervical screening, go for your pap smears. We always, whether you're at risk or not, we do recommend screening around breasts and mammos and that, especially those who are at risk. And then also remember, it is your uterus, your ovaries, your reproductive system. It needs to be checked. We do our checks with our scans and things to check for endometrial, uterine cancers, ovarian cancer. So I think from a woman's health point of view, it is still important post-menopause. We also post-menopause need to look out for osteoporosis, for other consequences and long-term problems with regard to menopause, which is a longer conversation than you and I have. But I have to encourage women, go to your gynecologist, go to your well woman doctors, get your checks after menopause. Don't just think, and most importantly, I must just say, if your period comes back after it has stayed away for more than 1 year, do not automatically tell your girlfriends and your other friends that oh, it's just my period coming back. That is very relevant. If there is bleeding post-menopausally, that needs to be checked out almost immediately. So that is the kind of health advice I would give for women going forward.
Thank you so much.
And discuss it with each other, please.
Absolutely.
We need to get education.
That's it. We got to talk to each other about it. You don't hide behind this and act like you're the only person going through it. We're all going through something
suffer in silence.
A different way. Thank you. Thanks, Doctor.
Yeah.
It's a pleasure speaking to you.
Thanks so much for that.
President of the South African Menopause Society, Dr. Malikah van der Schyff, talking to us about menopause. You know, ladies, it's a natural port of life, unfortunately, and not too much to look forward to, is it, ladies? Or if you're going through it, oh man, sympathies, and I hope that you have chosen the right path for yourself for it.